Hello, good evening. I am Isha Thakur and I welcome you to Librate's YouTube channel for another live session. Today, in this session, we have the privilege to host Dr. Salil Jain, a very renowned name in the field of nephrology and more than 20 years of experience. He is currently working as the director and head of department, nephrology and renal transplant at Fortis Memorial Research Institute, Gurgaon. He has many publications in national and international journals to his credit and also a member of Indian Society of Nephrology and Indian Society of Organ Transplant. With all of his experience and expertise, he is going to help us understand diagnosis and prevention of chronic kidney disease among all of us and all the related queries. Welcome, Dr. Salil Jain, and thank you for taking out time for this session. To our viewers, chronic kidney failure is also called chronic kidney disease. It is described as the gradual loss of kidney function. Kidney plays an important role like filtering waste and excessive fluids from our body, which are then excreted out of our body through the urine. If the kidney functions are lost, all the waste material gets retained within the body and builds up in dangerous levels. During the next few minutes, Dr. Salil Jain will be talking about diagnosis and prevention of chronic kidney disease, and also the various unknown facts that we are not put under the light, and we all are unaware of those facts. In this session, he will be explaining the basic information related to the chronic kidney disease, focusing on the diagnosis and prevention we must take and all the other related clinical details on the same. He will also put the light on the other clinical illness which may cause more implications. My request to our viewers who have tuned in, please feel free to ask your questions in the comment section and we will take them later. Over to you, Doctor.
Thank you, Visha. Thanks for the introduction and good evening, all the viewers, and thank you for joining this webinar. Uh, so, I'll give you my introduction again. I am Dr. Salil Jain, and I'm working as director and head of the department in nephrology and kidney transplant at Fortis Memorial Research Institute, which is situated in Gurgaon, Haryana. And basically, most of the people do not know actually what is nephrology. To start, nephrology means a branch which deals with the kidney diseases. Kidney diseases, and when the patient has kidney failure, then we take care of dialysis and transplant are the two options by which a person can live. So we take care of that also. So before I start the presentation is basically just to give you an outline, whereas I would be discussing initially about what are the functions of the kidney. So, so this is my presentation. Uh, so, why we are discussing actually this kidney disease? If you see in 1980s or 70s, there was hardly any discussion about actually kidney disease, and it was mainly neurology, brain problems, heart problems which have been discussed. And most of the universities, especially the medical university, did not have any specialization of kidney disease, and there was no branch of nephrology. So, in 1970s, only the it was introduced as a super specialty branch. And why it was came so late, because most of the people were concerned about heart and brain, and it was realized that yes, kidney is also an important function, and there are patients who are having kidney disease. And over the last 4 5 decades, we have seen that the kidney disease is getting more and more commoner. And presently, if you see that 1 person in 10 in general population has some degree of kidney damage. I'm not saying that they are all in dialysis or transplant, but even a small presence of protein in the urine actually is a marker of kidney disease. And there are It's very common, and at least one person in 10 is having this kind of a problem. And globally, there are around 500 million individuals, and in India, approximately 100 million individuals. So there was a study done by All India Institute in Delhi, and they were trying to find out how many patients do we have of kidney disease in Delhi, and they found that there are like 11% of the population was suffering from diabetes, and 22.8% were suffering from high blood pressure. And out of this, 30% of these patients were having kidney disease. And these patients who were having kidney disease, diabetes was the reason for kidney failure in 41%, and high blood pressure in 22%, and rest was other causes which I will be telling you about later on in the uh, during my talk. So diabetes and blood pressure are one of the most common reason for kidney diseases. So to start with, where are our kidneys? Actually, they are at the back, and they are bean shaped organs, and they are at the level of the waist, of, and they are of the size of a fist, weighing around 150 to 200 grams. And their size, usually, if it is less than 9 centimeters, then we tell them that the kidneys have shrunken, and there is a permanent damage in those kidneys. So usually they are bigger, around 9 to 11 centimeters in length. So what are the function of the kidneys? Why they are so important? Why we are I'm concerned about and talking to you about kidney disease today? So kidneys have a lot of important functions, and it's not just to make urine actually. So main job the kidney that has is to remove the waste products. So whenever we are eating, and we are working or exercising, even when we are sleeping, our muscles are still working, like we are breathing, our heart is working, it's pumping. At that time also, uh, most of our body functions are performing, and there are byproducts. Just like to give you an example, like a car is there. So if you put in a petrol that moves, then there is a exhaust there. So there has to be similarly when we eat and everything, there is a metabolic phenomenon which is occurring, and there are a lot of waste products which are produced. And kidney is one of the uh, medium through which these waste products are thrown out of the body, and takes care of our body. So supposing if I drink around 2 to 3 liters at a go, so I do not retain everything. My kidneys have got sensors where they will judge that okay, the water content in our body is going up, so I will pass more urine. If I am not drinking enough water, so my urine output will go down. So I won't pass much urine because the body will sense that okay, we are not drinking enough water, so it will try to retain, and kidneys will not throw out more urine. So kidney is mm, make sure that the volume status of the water content of our body is remains good. The urea, creatine, all the toxin material are thrown out along with this water. So toxins, the fluid control, then by controlling, it's very essential for blood pressure along with the heart. This kidney also controls the blood pressure, because it also sees that if you are taking salted food and if your blood pressure is going up, it throws out that salt, it throws out the extra water, it controls the contractility of the blood vessels, so that your blood pressure always remains in the good range and doesn't harm your organs. It also has since you know that the kidney, all the blood actually comes here to get filtered. So the kidney is like in a language, I can tell you, like kidney is a bag of blood vessels, and a whole of the blood of the body which is pumped by the heart actually is coming into the kidney. So kidney is a very good sensor. The god has given us good sensor there, and they can, kidney can sense that hemoglobin is maintained at a good level or not. In case the hemoglobin is not maintained, it sends a a hormone or a message to your bone marrows where actually the red blood cell factory is. And whenever the hemoglobin goes down, this hormone or the message goes to the bone marrow that our body needs more hemoglobin, and the bone marrow starts making more blood. So if the kidney is not working, then this red blood cell factory is not activated. The message is not sent to the bone marrow. And that's why the patients with kidney disease have low hemoglobin also. They also maintain the bones health and the calcium, phosphorus. These are the main constituents of any bone, and the metabolism of calcium and phosphorus is handled by the kidneys. So, apart from the cleaning of the toxins, water balance, blood pressure maintenance, hemoglobin maintenance, bone health, balancing the acid base, the pH of our blood, which helps in actually maintaining all the chemical reactions that are occurring in our body. These are all functions of the kidneys, and if they fail, all these processes get deranged. And if they get deranged, then what we have is that waste products will start getting accumulated, and we will start feeling lethargic, sick. And because the hemoglobin will be on the lower side, we will be looking more pale and feeling tired. There won't be any energy to work. And since the urine quantity will go down, most of the patients start having fluid accumulation, and that can lead to swelling over the ankle, puffiness of the face, and the urea, the toxins that are supposed to go out through the urine, they will be retained in the body, and it can cause bad taste in the mouth, and smell also can be problem. So these are the symptoms: decreased appetite, nausea, vomiting, and since the patient is not eating well, there will be a loss of weight. And some patients, because of the gain of the fluid, their weight can become high also. Most of these patients with kidney disease have a lot of constipation. There can be a decreased sensation in the hands and feet. They feel more tired. The energy level is on the lower side. The mind becomes actually clouded. The concentration ability, alertness, they all go down. There will be decreased sexual functioning. The skin may become very dry and very itchy. So these are the common symptoms of kidney disease. Now, after discussing these symptoms, we come to a reason why this has happened. As I already told you, diabetes and blood pressure are the most common reason for the kidney damage. All over world, if you see, diabetes and blood pressure are on rise. India is called like a capital of diabetes of the world. And why this is happening? The diabetes and hypertension are related to some extent to our lifestyle also. With the advent of uh, fast food and presence of the uh, transport facilities, we are walking less nowadays. Children are eating more fatty food. Third, the mobility, and if you see in the grounds or playgrounds, there are less children who are playing right now. Most of them are like sitting in the front of the laptop playing video games, and so the outdoor activities of everyone has gone down. If we have to go to office, take we do not walk, we take help of the transports like any kind of a vehicle. So all this lifestyle changes has led to increase in the diabetes and blood pressure incidence, and the longevity of people also have increased. So a person now, even at the age of 30 and 40 years, we are seeing patients who are having diabetes and blood pressure. Previously it used to be that only elderlies, like in the range of 50s and 60s, these patients were having diabetes and blood pressure. So this diabetes is causing a lot of problem. And the other thing which is causing this problem is obesity. So lack of exercise and the eating habits are leading to this increased incidence of diabetes and blood pressure. The other most common reason is the drugs. Drugs means the over-the-counter medications that are available with the chemist, like painkillers. If you have a knee problem, you go and take a painkiller. You have a headache, you take a painkiller. And most of the patients are nowadays taking painkillers over the counter without trying to find out why they are having the headache or why they are having the knee problem, and without trying to solve the mm, reason for that headache or reason for the knee pain or a backache, but just taking symptomatic treatment. And this is causing the problem. And if you keep on taking these painkillers, the kidneys can get damaged. Recently, I had a patient, a young patient who was studying professionally, very well qualified engineer who came, with complaints of kidney disease. When I asked him what could be the reason, and he told me that he used to have headaches, and he was taking and painkillers like Combiflam, Brufen, and Numilicide, and all these medications which are available over the counters, and he used to feel better after taking that, and his headache used to go away. But he never went to a doctor or to see why he is having a headache. And when he once he during his health checkup, they found that his blood pressure was very high, and that was the reason for his headache. And by the time he had done all the tests to find out why his blood pressure was high, it was found that his kidneys were damaged. So these painkillers can be a problem. If we would have gone initially and have found that it's the high blood pressure which is causing the headaches, he wouldn't have taken the blood pressure medications and would not have taken the painkillers, and his kidneys would have been saved. So we have to be very careful with the medications. Don't take over the counter even for acidity. The new drugs which are coming, like people are taking pantoprazole. These have now come to know to cause kidney damage. So I would request everyone, if they are uh, taking any medications long term without the prescription of a doctor, without discussing with the doctor, they must go and discuss with them and ask them if they have any, why they are needing this medication, is there any side effects of these medications, and then only take it. The other reasons for kidney damage are like presence of kidney stones and inflammations of the kidney tissue. The immune system, which is supposed to actually protect us, sometimes get disturbed and can damage our own kidneys. So there are conditions like lupus, SLE, rheumatoid arthritis, which can actually damage our kidneys. And uh, other common is the infections, the urine infections. So recurrent urine infections, if somebody is having, then there can be a damage to the kidneys, and you should consult your doctor why they are getting the recurrent urine infection, and probably get those reason for that, why the recurrence of urine infection is happening, and they should get it treated. There are some hereditary conditions also where cysts are formed in the kidneys. There are recurrent stone formation in their kidneys, which also can cause kidney damage. But overall, I would like to tell you that diabetes and blood pressure are the most common reason for uh, kidney disease. Now, what are the how can we know that we are having, apart from the symptoms, if there are any time blood in the urine, or if any test shows, a urine test shows that there is a protein in urine, or any abnormal cells which are there, then it signifies that there might be a damage to your kidneys, and you should see a doctor immediately and should not ignore it. So there are two simple tests. One is urine, and it is a very cheap test, and I would suggest that um, everyone who is above age of 40 years, at least once in a year, should do the urine examination uh, to see if there is a protein loss or presence of any blood in the urine, and if there is, they should consult their physician. And another test is your blood test, which with every health check is done and ask for creatinine, and the creatinine usually is converted into what we call as GFR, and should discuss with your physician if your kidney functions are normal or not. Now, if we do not ignore these test symptoms, if we ignore or we do not do the test, then lack of treatment of these kidney disease can lead to ultimately need for a dialysis and kidney transplant. And believe me, it's one of the worst things. And uh, though we have facilities to treat patients who have this advanced kidney disease by dialysis and kidney transplant, but if we can prevent it, that will be the best thing. Uh, Dialysis is done like 3 times in a week, and you have to visit the hospital and get your blood clean every day, every alternate day. Or there are dialysis which can be performed at home also, which is called peritoneal dialysis. But again, this does affect your quality and quantity of life, both the things. And similarly, kidney transplant is another option. If a person has an completely damaged kidney, a new kidney can be implanted in him, and they can have a good quality of life. But again, a lot of medications need to be then taken. A lot of prevention and hygiene has to be seen. So I would suggest that uh, if you take preventive measures right at the beginning, then you can prevent these complications from happening in your life. Now, to to make sure that you don't have kidney disease, you need to identify कि ये किन 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 को हो सकती है बीमारी किडनी डिजीज को, वो पहले आइडेंटिफाई कर ले. इट कैन हैपन टू एनीवन, बट who are the people who are at higher risk of having this kidney disease. So इनके लिए सबसे जरूरी है कि आप पहले ही अपने आप को पहचानें कि आप हाई रिस्क कैटेगरी में हैं कि नहीं. अगर आप हाई रिस्क कैटेगरी में हैं, इफ यू आर इन दिस हाई रिस्क कैटेगरी, then you have to take few tests on the regular basis and take extra precautions. So as you can see on my presentation, that if you are having diabetes, if you are having high blood pressure, if you are a smoker, if your cholesterol is not controlled, if you are above the age of 60 years, then, and the most important, if you have any person in your family who has already a kidney disease, then you come in a high risk category. I forgot to mention two more categories: a person who is having recurrent urinary tract infection and kidney stone formation. So, if any of disease, if you have these disease, then you are in high risk group, and I would suggest that you should take precautions. Now, if you are a diabetic and high blood pressure, then you should control it. The best way to control diabetes is actually to lose weight if you are obese, do regular kind of exercise. That holds true for the high blood pressure patient also, what we call as hypertension. So you should, if you are obese, you should lose weight. You should exercise regularly, at least for 45 minutes every day. If you can't jog or run or do, at least do brisk walking. If you are not used to it, start with 5 minutes, then gradually build up to 45 minutes, and try to do some kind of continuous walking without your mobile phone on. You should switch it off and then walk for 45 minutes. The second thing is that both measurements of blood sugar should be done regularly, and there is a test called HbA1c, which is called glycosylated hemoglobin. This test gives an average of blood sugar over the last 3 months, and this should be kept around 7%. If you keep this around 7%, the chances of getting kidney damage is very, very low. So right from the beginning, when you have diabetes, and if you keep this HbA1c every 3 months and keep on checking it, and if you keep around 7%, then the chances of kidney damage will be very, very low. Similarly, high blood pressure patients, if they keep their blood pressure around 130, 140, and the lower one around 80, then the chances that the high blood pressure will cause any damage to the kidneys will be very low. And mind you, if these two, if you are keeping control, you're actually protecting your brain also, you are protecting your heart also, and at the same time protecting your kidney also. So any person who has diabetes and high blood pressure should do glycosylated hemoglobin once in 3 months, blood pressure check at least once in 2 weeks to make sure that they are controlled. And the most important from kidney point of view, every 6 months, do a simple urine analysis. It costs you around 40-50 rupees or maximum 100 rupees, and it will give you an idea whether your kidneys are getting damaged or not. And believe me, initially the first investigation that comes positive is the presence of protein or red blood cells in the urine. And if you detect it at an early stage, this problem can be reversed also. So do your urine investigations if you are a diabetic and hypertension or high blood pressure patient. Every 6 months, at least do a urine analysis. If you are a smoker, you must stop smoking, not because just of lung cancer, but it definitely causes, independent of heart disease, it can cause direct kidney damage also. So smoking is bad for your lungs, bad for your heart, bad for your kidneys also. Similarly, high cholesterol levels can damage your kidneys, and any person who has a family history of kidney disease, then they should again do a urine analysis and keep a check on their blood pressure. The moment they have a high blood pressure, they should go and consult a physician and take a proper advice and investigation, giving telling them about the family member who had a kidney disease. Now there are patients who have stone formations. These patients should also go to a kidney specialist and ask them what kind of stone are there. And if you make adjustment in your diet, if you take like 2 to 3 liters of water, take a low salt diet, then the chances of getting stone again will be less. Similarly, for urine infection patients also, you should try to find out why you are getting urine infection, especially in elderly males. If there is a prostate problem, they should consult a urologist and take prostate medication so that they don't get the urine infection. In females, if there is a problem in urine, if they are having a dryness in the urine area, there can be a chances of recurrent infection. A gynec issue can cause a recurrent urine infection. If they solve this, then they can actually save their kidneys. So these are few of the preventive measures that I was talking to you. Please make sure that you follow them, and they will help you in keeping your kidneys healthy. The other main risk factor is, as I already told you, the painkillers. Please avoid them, and even if you have to take it, don't take it on the long term basis. Take it 1 or 2 days, and if you are repairing it for longer duration, discuss with your physician, doctor, and ask them why they are having this pain. Is there any way they can sort it out? Another test, contrast dye is another thing which can cause damage. So tests should be done judicially, and if you are getting a contrast, then make sure that you are taking good enough water before doing all these tests so that this dye can get washed out. So special stress will be, since the diabetes is one of the most common reason for kidney damage. I would just recapitulate: the patient who are having diabetes, even if they are not having kidney damage, they should do a urine examination very regularly. Keep on checking your sugars. Do a HbA1c test regularly every 3 months to make sure that their sugars are very well controlled. And any person who has diabetes, at least for 5 years, they should get their urine examination checked annually, and urine blood test called serum creatinine, blood urea, every year. And I would suggest a urine examination every 6 months. So this was about how to control your blood pressure, sugars, and exercise. Stop smoking, control your weight. This is A desirable weight is somewhere around the what we call as BMI. You can just put a BMI calculator in your Google, and weight and height. If you just enter, you will get your BMI. 18.5 to 24.9 is the ideal BMI. If you are higher than that, you must lose your weight. If you are smoking, stop it. If you have blood pressure, if you have sugars, then ask your doctor in case uh, there are medications which are called ACE inhibitors and ARBs, which can actually give protection to your kidneys also. So thank you for your time, and do not be afraid that kidney damage can be a problem. Yes, but we can prevent it. And in case if anybody listeners are having kidney disease, then we have a good solution for that also. So we have dialysis and transplantation. But my suggestion is that we should be more proactive and prevent these diseases. So I welcome questions now. Thank you very
Thank
much.
you, Thank you, Dr. Salil, for providing us with such insights over this particular problem. Now we'll take questions from our viewers. So, first question we have from our viewer is, what are the different stages of chronic kidney disease?
So there are five stages of kidney damage, and stage five, I would start from the worst thing. Stage five is called end stage kidney disease, where the kidney function, both the kidney functions are kidneys are functioning less than 15%. At that time, if the patient usually requires renal replacement therapy because the body is not able to handle all the toxins, and the amount of toxins in the body build up a lot, and there can be high blood pressures, and their appetite goes down because of the urea taste in the mouth, and they become breathless because of the acid in the body. So here in stage 5, when the kidney functions goes below 15%, then you require dialysis and kidney transplantation. And if your kidney function is between 15 and 30%, we call it stage 4, where actually you start making preparations for dialysis and kidney transplantation. So if your kidney function is between 15 and 30%, then you should think about future, like with whether you are going for kidney transplantation, then you should be looking out for your donor कि कौन donate करेगा आपको, who can be the suitable donor in your family. And if you are not planning for kidney transplant, then you should look for what we call as a preparation for dialysis, and there's a process what we call a small surgery, a fistula formation, which will help in initiating dialysis, so that you can discuss with your doctor that you need to have an access, the blood access for dialysis, and he should get it made in that stage. Stage 3 is between 30 and 60, where we usually control it and specify that the blood pressure and sugars can be controlled so that you do not progress to stage 4. And stage 2 and 1 is like kidney function is between 60 and 90%. And stage 1 is the earliest stage when the kidney function is around 100%, like more than 90%. And that's the initial stage where I'm discussing, and I'm the point I wanted to put, that we should catch hold of kidney patients at the stage 1 or before it. And if we are able to get hold of patients in stage 1, then most of the problems that we can avoid reaching the stage 5. Okay, so if we get diagnose this kidney disease at stage 1, then we can actually save you from dialysis and kidney transplant. So that is the importance of doing regular blood pressure check, blood sugar check, a urine examination regularly.
So, doctor, when we talk about diseases, we all know that one disease causes another disease. So, in this chronic kidney disease, what are the other health problems that this disease can cause?
So We know that diabetes and blood pressure are the most common reason for kidney damage, and diabetes and blood pressure at the same time, if they are damaging the kidneys, so one organ of the body is getting damaged, so they might be having an impact on the brain and the heart also. And especially if your kidneys get damaged, there is a at least what we call as fourfold higher chance of having a heart disease, and that's the most common reason for most of the kidney disease patients. Uh, they do not die because of the kidney disease, if I may say, because we have a replacement for kidneys. We can put a new kidney. We can do the dialysis regularly and take out the toxins. But most of the patients, they because of the toxins retained in the body, their heart becomes very weak. There is a saying here in our nephrology that a person who is 20 years and he is on dialysis has a heart of an 80-year-old person. So the kidney disease has a very, very high impact on the heart, and most of the patients will have some kind of a heart disease. So better to avoid having a kidney disease. The second impact is on the immune system. So the immunity becomes very low, and as you are aware, during this pandemic, along with patients who have diabetes, heart disease, and now kidney disease, they are at high risk of having a COVID problem, and chances of survival actually goes down in these patients. So I would say heart disease and poor immune system are having the kidney is having impact on these two systems.
Another question we have from our viewer doctor, that how can a person diagnose that he is suffering or he she is suffering from chronic kidney disease?
So as I already told you, if you do a urine analysis, that's the first thing I would suggest. Uh, if there is a persistent presence of protein in the urine, like you have done a test today and there was a protein presence now, and you repeat the test after a month again and the protein is still persistent, uh, and at that time you are not having any other illness like a fever or cough or any high protein intake or exercise, you have not done any this kind of a thing, and the protein is still persisting in your urine, then that's a marker of the kidney disease. Apart from this, a blood test which shows a high urea, high creatinine, that is a marker of kidney damage. And I would suggest to all the viewers that whenever they look at the creatinine, please convert that creatinine into what we call as a GFR. Actually, GFR means a glomerular filtration rate. Kidneys function is actually a filtration. So the ideal way to assess the kidney function is by estimating the GFR. And if you can just Google GFR calculator, there will be like tens of calculators available. If you can just click on that, you have to just enter your age, sex, race, and the creatinine value. And if you can convert this into GFR, you will know which stage of kidney disease, which I have already told you, you will come to know about it. Or if you are healthy, then it will be in the normal range. So blood test where you do the creatinine and convert into GFR, urine test for proteins, then an ultrasound where you can look at the size of the kidney, if there are any swelling over the kidneys, if they are large in the size or they are small in the size. These can let us know about the diagnosis of kidney disease. And sometimes we have to even do a kidney biopsy, like take a put in a needle in the kidney and take out a hair-like piece. And we do not do it to know whether there is a cancer or something, but we do it as to find out what kind of disease the kidney is having, why the creatinine is high, why the protein loss is there. So kidney biopsy is an invasive test, but we keep it for the last when we do not have enough evidence to know what is going wrong with the kidneys. Then we have to sometimes take to and do kidney biopsy, and it's a safe procedure. Yeah. done properly with proper precautions, it should not be a problem. People are usually afraid of kidney biopsy, but I would suggest them that if it is needed, please go ahead with it. If your doctor is recommending, get it done because it can save you from future dialysis and kidney transplant. It's just like if you have high grade fever and you want to know whether it is TB or typhoid or pneumonia or malaria or dengue, you do a blood test. You put in a needle and take out the blood. Similarly, for any kidney disease, we have to just put in a small needle under local anesthesia and take out a small hair-like piece from your kidneys and study it and to tell you what is going on with your kidney and give you a diagnosis and treatment appropriately. And we can save you from going to dialysis and kidney transplant. But this is a kind of a last test. Before that, the urine, blood, and ultrasound, CT scan will be the initial test.
Okay, so doctor, if we talk about treatments, so what are the treatments available for chronic kidney disease?
A very good question, Isha. The treatment options for kidney disease. So basically, we have to first treating kidney disease. We have to find out why we are having this kidney disease. If it is diabetes, then control your diabetes. If it is because of the high blood pressure, control your blood pressure. So these are the damaging things. If you control these two things adequately, your kidney damage will be less. So there is no medical medication that I can tell you that okay, you take this medicine and your kidneys will be back to normal. So initially, and most of the believe me, 70% of the patients are having diabetes and blood pressure as the reason for their kidney damage. So if they just control their sugars well, if they control their blood pressure well, as I told you, the glycosylated hemoglobin HbA1c is 7, and if they control their blood pressure like 130, 80% of the treatment is done. Okay, the 10-20% of the treatment that we do is will be actually controlling the hemoglobin. I told you like the kidney, one of the kidney function is to make hemoglobin. So if kidney is not functioning, so we have to control the hemoglobin. We'll control the cholesterol. We'll look at the acid balance. We'll look at the calcium and phosphorus so that the bones are not weak. So this is forms the 20 and 30% of our treatment. But the mainstay of the treatment remains controlling the blood pressure and diabetes. Apart from this, if we feel that the patient does not have diabetes and blood pressure as the reason for their kidney damage, then as I told you, most of the patients will need a kidney biopsy, and depending upon the findings of the biopsy, we should do the treatment. Some of the common reasons are a drug-induced kidney damage that can be treated by steroids. There are immune system damaged kidney. As I told you that sometimes the immune system, which is supposed to protect us from bacteria and viruses, this immune system suddenly starts acting on our kidney filters and damage them. So this, if we diagnose over the kidney biopsy, we can treat it by giving steroids. So these are the treatment options usually. And if you have urine infections, treat with antibiotics, which are safe for the kidneys, and make sure that you don't get recurrent urinary infections. If there's a prostate which is causing the issue, solve that thing. In females, if it is the prolapse of the uterus which is causing the obstruction, or dryness in the vaginal area which is causing this issue, recurrent infections, get it solved. So these are the ways we can control the kidney disease.
Another question we have from our viewer, doctor, that if a person is on kidney dialysis, then what are the complications and what are the things that person should take care of on dialysis?
So being on dialysis is uh, a big issue, and it's very difficult for the family to come regularly to the dialysis. So my first uh, suggestion to all the patients who are on dialysis is that please do regular dialysis. Do not miss the sessions. If you are not feeling well, it's all the more important that you should be on going to the hospital and meeting the doctor and take the dialysis. People, most of the do what they do is that if they are not feeling, they do not come for the dialysis, but that's not good, and they should come to the dialysis, meet the doctor, and get the dialysis done. When you are sick, actually you are more forming more toxins, so removal of those toxins is actually more important when you are not doing well. So a regular dialysis should be done. They should take the full session of 4 hours, make sure that the technicians are taking full precautions. uh, Another thing that they should look after is their weight, that between two sessions of dialysis they should not gain more than 2 kilos of weight. If they take gain more than 2 liters, the fluid can be removed on the dialysis. But every time if it's more like 3 liters or 4 liters, the machine will just take out the water, but there will be lot of stress on your heart also, and that is not good, because as I told you, the kidney disease patients have a weak heart, and if you keep on putting more stress on your heart by removing more water every time, then it's going to be a big problem. So make sure that you do not gain more than 2 kilos between two sessions of dialysis. The fourth thing is your diet. You should be taking a high protein diet. A vegetarian diet is very low in protein. So especially the vegetarians, they should make sure that they are taking protein supplements along with their diet, and taking less of salt, and liquid content should be on the lower side, making sure that they do not gain more than 2 kilos between two sessions of dialysis. And salt, as I told you, salt and low salt, low fat diet, plus low potassium diet. So most of the patients have chances of getting high potassium, so they should avoid food which are rich in potassiums like coconut water, dry fruits, nuts, bananas or citrus fruits. So these chocolates, they should be avoiding all this.
So, doctor, moving on to the last question for the session, is there any home remedies or lifestyle management to overcome chronic kidney disease?
So there are no home remedies as such, and I would suggest not to depend on those home remedies. You should come to a physician, a specialist, discuss with them uh, your problems, and take proper medications. As I told you, most of the kidney disease are because of the diabetes and blood pressure. So get a good proper control of them with the help of the physician. And in case you want some kind of a home remedy, you want to use it, so don't hide it from the doctor. Discuss with him. Tell him that okay, you would like to use this soft ka juice or karele ka juice, and whatever you want to use. Have a discussion with them. Don't hide these things, because we have seen that if you try to hide, then it actually is a difficult thing for us to manage the sugars and blood pressure. uh, you should be open about it. Tell him that I would like to take this. Would you like to recommend this thing? In case I would like to take it, what other precautions should I take? Should I, how frequently then I need to monitor? Because I've seen patients who are diabetics, and they are taking Ayurveda medications or some kind of naturopathy treatment, and they stop taking your diabetes treatment, and at the same time they would stop checking their blood sugar also. So if you are favoring naturopathy, which I'm okay with it, it's a personal thing. If you want a Ayurvedic treatment, that's a valid system of medicine. If you want to do that, do it. But my suggestion would be then please actually keep on doing your tests regularly. And if you feel that with this kind of treatment you are not getting control, come back to us. Okay, and keep on checking your blood sugars regularly, or blood pressure regularly, or whatever treatment you are taking, whether your kidney function is deteriorating or not. So my suggestion is that please have a good hearty discussion with your doctors before you think about any home remedies. Lifestyle, I have already told you that you need to lose weight if you are on overweight or obese, and even if you are normal and normal weight and Even then, 45 minutes of walking, brisk walking or exercise should be done. Stop smoking in case you are smoking. Alcohol should be taken like not on the regular basis. It should be a control this thing. And low fat diet, saturated fat should be avoided. Oily food should be avoided. Then salt content, as much as possible take less of salt. And salt is not just the salt that you are using in cooking or adding in the dahi that you eat, but salt is also in achar, papad, namkeen biscuits, namkeen mixture, dal mot and all those things. These are also source of salt. So most of the people say that they are not eating much salt, but chips khate hain, so that's not good.
Thank you so much, Dr. Salil, for your time this evening. We hope our viewers could get help from your informative views. This was a very enlightening session. To our viewers, please reach out to your nearest specialist doctors to get a personalized consultation on your health. Librate is also here to convey true and authentic information during this COVID era. This marks the end of the current session. We will be back with more information in the next. Till then, stay tuned.
Thank you, Ishita. Thank you.